This is Dr. Aritra Konar, Consultant Interventional Cardiologist, presently attached with Apollo Multispeciality Hospital, Kolkata. Now I will be talking about heart failure. Little bit, few words about heart failure only. I am not going in details. So, for everyone's comprehension, I will be telling you about the heart failure in very simple words. So, what is heart failure actually? Failure of any organ means that organ is not being able to do its proper function. It's a very simple term. So heart failure means heart is not being able to do its proper function. So actually, what is the function of heart? Heart is an organ in the body which receives blood and as well as pumps out blood to the other part of the body to maintain the blood circulation of the body, of the human body, of an animal body actually. So if heart failure occurs, that means heart is not being able to, either it's not being able to receive the blood in its chamber, or it's not being able to pump out the blood from its chamber. So both the function or either one of these functions are not being done properly, which is causing the heart to fail. That means the heart is not being able to do its proper work. That is heart failure. Now how do we know that a patient is suffering from heart failure? So some basic symptoms may be there with which the patient will come to us, like dyspnea on exertion, respiratory distress, feeling breathlessness on exertional activities. In very early stage, patients come with that kind of symptoms. Fatigability, extreme weakness when he is trying to climb up stairs or walking for a long time or walking in a very brisk speed. So those type of symptoms may be there. And also there may be some development of pedal swelling and also development of facial puffiness and the swelling of all over the body. These types of features may be there, which may suggest that the patient is developing heart failure. Why it's happening? Why these symptoms happen? Because if the heart cannot pump out blood properly, then there will be fatigue, and also the congestion of, as the heart is not pumping the blood, the congestion will be there on the lungs, and as the fluid will be congested and fluid overload will be there in the lungs, then there will be breathlessness. We will feel breathless. And also, if another thing happens, if the heart cannot receive the blood properly, then the fluid will be accumulated in all part of the body, maybe at the lower part of the lungs and also at the dependent part of the body, mostly in the both lower limbs. So it will develop as bipedal edema. So with these kind of symptoms, a heart failure patient comes to us. Now, how to diagnose heart failure? When a patient comes to us with these kind of symptoms, we do some basic tests like an echocardiography and ECG, and some other blood tests which also can pick heart failure is blood for NT-proBNP. So with a simple blood test and with a simple echocardiography test, we can pick up whether the patient is suffering from heart failure, whether the heart pumping capability is low, whether the heart is having some diastolic dysfunction, that means heart is not being able to receive the blood properly, all those aspects. And the heart failure thing should be treated as early as possible. With some simple medicines, we can start treating heart failure, like diuretics. We have heard the medicines like Lasix, furosemide, those type of drugs which actually removes extra water from the body through urine. So that is the cornerstone of therapy of heart failure. There are other several measures to treat heart failure, but I am not going into detail. One last thing to remember is that heart failure and heart attack is not the same thing. These are totally different entity. Heart attack is a condition of the heart where patient have severe chest pain due to acute blockage of any coronary artery which gives blood supply to the heart muscles. That is an heart attack. But heart failure is totally different. Heart failure is when the heart cannot pump out blood. Heart failure can be a consequence of heart attack, or heart failure can arise from several other causes, from heart attack, from heart muscle disease, from high blood pressure, there can be several other reasons of development of heart failure. So heart attack and heart failure are not the same entity. But if we develop heart failure, meet your cardiologist at your doorstep or come to us at our hospitals. We will examine you, we will do necessary investigations, and we will start treatment as early as possible to keep you healthy for a long period of time. Thank you.